Welcome back, Nashville. You're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason here on News Radio 1510 WLAC. We are your local health and wellness experts. My name is Dr. Elizabeth Baker, and my office is down in Brentwood.
And I'm Dr. Jason Reinhardt. I'm just a little south of Dr. Baker. I'm in Franklin.
And together we have a combined experience of over 23 years in practice dealing with various types of musculoskeletal and immune system problems.
Yeah, and also physical problems. You know, one of the things I'd love to kick off this hour with is, one of the interesting reasons that people have come into my office. And I've had actually a number of women come in who are terrified to look like their moms. They don't want that hump in their back.
Oh, yeah, that's a common one.
Yeah, nursing home posture, I call it.
Mm-hmm. Nursing home posture, old lady hump, hunchback, whatever you want to call it. It's all the same thing. Nobody really wants to look like that, though. But you go out and look at people walking down the sidewalk nowadays, and I've seen it in people in their teenage years. They're starting to get these humps because we're all so hunched forward with our smartphones, our laptops, our iPads. Everybody's so forward, it's starting to stay stuck that way.
Yeah, and, we have so many people come in for different reasons. Headaches, neck pain, mid-back pain, low back pain. They don't look right. I have a number of people that say, I can't get my posture right. I can't stand up straight. Help me with that. I've tried as hard as I can. My body doesn't move right anymore.
Yeah, and as we get older, things don't just magically get easier. If you've started having any number of birthdays past the age of 7, you'll notice that your body doesn't act the same each year from year to year even.
Yeah, and I always tell people, I kind of compare their bodies to an automobile. I said, what would your car be like if you never got a tune-up on your car? What would it be like? What kind of life would it give you? What would it be sounding like right now? Because that's what you've done with your body. You have never tuned it up.
I say that just about every day to patients that come in. Maybe they got off track. Maybe they got, let's say they went out of town for a couple of weeks and they came back and they'll say, well, hey, how was I looking, doc? I felt like I was starting to tighten up again, or I felt like I was starting to get stiff again. And I'll say, yeah, you were a little past due for your tune-up. It was time for your oil change last week, and I'm glad you got in this week.
Yeah, and we live in such a busy, fast-paced, hectic, stressful world right now. I give so many parents credit because they're trying so hard that what they've done is they've put themselves and their health on the back burner. They've put something else center stage, whether it's taking care of the kids or their work or their social activities, and their health has suffered. And now they're at the point where it's really affecting them because they can't do what they want to do. They can't be the parent they want to be. They can't be the support they want to, be. They can't volunteer, or that it's affecting their job, and now they're forced to come in and get help.
And that sparks another thought that I just had. I have a patient who actually came in from hearing us on this radio show, and he's been seeing me now for a couple of months, and he said he was listening to the show last week, and where we gave that tip about how to determine if your headaches are coming from a neck problem, that lay on the bed trick I told you about.
Yeah.
And if you are listening and you want to know what that trick is, go back and listen to our last episode. But what he said was, I was listening to that, and I had my wife, before she took another ibuprofen for her headache, I said, I want you to try that trick Dr. Liz told us about. Go lay on the bed, hang your head off the bed, and see if your headache goes away. And he said it worked. And I said, okay, so when is she coming in? And he said, well, she's just not ready to come in just yet. And I said, well, why? Why would she want to let something get worse before she takes action? And I still don't understand that, but it's a really common thing that we hear. And a lot of times I'll say, you know what, you'll wish you felt like you feel today in 10 years if you don't do something about it now.
Yeah. And we love to give out helpful tips and things that you can do to improve your life. But a lot of it comes down to you can only patch a tire for so long before you got to replace it.
Yeah. You pull the screw out, put the patch on it, but it's still eventually you're going to need to replace it.
Yeah. And there just comes a point where you need to come in. And if we're talking to you and you're saying, you know what, I have headaches, I have neck pain, I'm starting to get that posture home or nursing home posture.
Posture home.
Yeah, posture home. You know what I'm talking about.
Yeah.
Every week we have a limited number of spots where you can come into our office, meet with us, and find out how we can help you. We offer exam consultation, x-rays. It's a $250 value. We do it for only a $40 investment. It's limited number of spots. It does not include workers' comp, Medicare. But if you want to take advantage of that, give us a call. You can reach us at 615-727-3107.
Or if you're driving and don't have a pen handy, go to a guide to healthylivingradio.com. All the information is also there. And, if this is something that you're wanting to get checked out, but you're like, hey, I can't get in this week, go ahead and give us a call. We'll get you on the schedule for next week.
Yeah, but do it now because, like I said, we only have a certain number of spots, and our staff will kill us if we give away more than the spots we have. So.
Yeah, that and, we get people that call in multiple times a day that fill up the spots as well, so we have to have availability for those people also.
Yep. But in this episode, we want to talk about something that, is a big topic right now in both our offices, neck pain and headaches. We have so many people that it's affecting their life right now, and we want to give some tips. We want to tell you how we address them and, just give you some action plans so that you don't have to keep suffering. Maybe you're a person that's popping pills continuously, or you're a person that's just learned to live with it. Mm-hmm. We want to tell you that there's a different way.
And there's actually a detrimental thing that you're doing to yourself by allowing it to continue. It may be tolerable for now, but eventually it's not going to be.
Yeah. And, with our world right now, with all the stress involved, we call them tension headaches. It affects 80% of the population. So if you're one of those people, long day, dealing with the kids, you're at work, whatever, you're getting headaches on a regular basis, most likely you're in that 80% of the population. You're suffering from tension headaches.
And the good thing is about tension headaches is that chiropractic is one of the best things to help tension headaches. Sure, you can pop a pill and it'll make it go away temporarily, but they keep returning. The best thing that you can imagine is not having those headaches continue to come back over and over every day.
Yeah, one of my favorite things is when my patients come in, especially a new patient suffering with these tension headaches, we start adjusting them and they come in right away and they're like, I can't believe it. I've been having these headaches on a regular basis for the last 3, 4, 5 years, and I've got adjusted a few times. I'm already noticing a difference. Mm-hmm. I love hearing that because it means their body is truly healing.
Yeah, and so if you're one of these people, give us a call, 615-727-3107. That'll get you an exam, consultation, and x-rays with either Dr. Jason or myself or one of our other trusted doctors around the Nashville area. It's normally a $250 value. It's only $20. But stay tuned with us. When we come back, I would like to go over a couple of other tips. I guess I'll give you that tip that I mentioned last week in case you missed our show over Memorial Day weekend, but give you some tips of what you can do at home for these headaches and to see if it's related to your neck. We'll be back with a guide to healthy living in just a short bit.
Welcome back. You're listening to A Guide to Healthy Living here on News Radio 1510 WLAC Nashville. We're talking to you. I also want to give a shout out to Brentwood, where Dr. Liz's office is located, and a little south of there to Franklin. That's where I'm located.
Yeah, but we also have doctors all around the city that we also trust. So if we're not near you at all, you can always give us a call and we can suggest somebody in your area.
Yeah, definitely. Today we are talking about headaches and neck pain and other things that are bringing people into our offices this week. Just general aches and pains that people are sick and tired of dealing with.
Headaches and neck pain are probably the most common things I see people for, right ahead of the low back pain.
Yeah, just
low
like
back, hip, and butt pain. I guess they're kind of all included there.
Yeah, I mean, it is amazing to me. You look at tension headaches, which we were just talking about in the last segment, affects 80% of the population. I mean, that is a huge number of people that are suffering from headaches every day.
And more common in women than they are men, and it's the most common type of headache that most people are getting. And I would say most of those tension headaches are something called cervicogenic, meaning they come from your neck. They usually are a problem with the upper cervical region of the neck, the C1, C2 area. So if you've ever been to a chiropractor before or heard any of that lingo, that's usually what causes the headaches.
Yeah, and one of the beautiful things about chiropractic is once you start getting your body tuned up, I always say you have more wiggle room. Meaning, if you are one of these people that are suffering from tension headaches, let's just say that, boy, something happens, you start getting ticked off, your blood's boiling, you feel yourself tightening up, and then that headache starts coming on. You start getting your body into better shape, you're going to have a little bit of wiggle room before that headache starts coming. And you might even get to the point where you're not even having them anymore. But I love that to say, let's say you have 10% wiggle room. What would it be like you have 50% wiggle room?
Exactly. I have a lady that she was a patient of mine a few years ago, and then I'm not sure if she moved or changed jobs or what, but she came back to me recently, and she had been having headaches. And from what I had in my notes, that wasn't one of her major issues when she was visiting us before. But we took those special kind of x-rays that we take and went through that whole process with her and discovered that she was having cervicogenic headaches. Her headaches were coming from a neck problem. She said since she has started with this new treatment plan that we've put her on, she has had 0 headaches when she was having 2 and 3 headaches a day previous to coming in. So that's the kind of stuff that we can help with. And it always amazes me how many people are out there that have headaches just about every day.
Well, and I
can't even imagine.
Yeah, and I love when people say, I love that I'm paying you and I'm getting healthy rather than keeping Advil, Tylenol, ibuprofen in business.
Yeah, or even the ones that take the prescription medications. They have been to their doctors or their neurologists multiple times, and what I find to be a very common medical solution for it is, well, this pill didn't work. Let's add another to it. They don't necessarily take it away. Sometimes they do, and they change to a different prescription. But sometimes they'll end up adding 2, 3, or 4 medications, and the people are still getting the headaches. And it's like beating your head against the wall. Stop beating your head against the wall, and your head will stop hurting. So in my, opinion, the pills aren't helping. Let's do something different.
Well, and we live in a wait and monitor society, meaning that if you go the medical route, you have headaches, for instance, they're going to say, let's figure out a drug to put you on. Then they're going to say, how is that working? You're going to say, well, it's working, it's not working. They're going to alter the medications to finally get to a point. Let's just say that you're saying, hey, the headaches are a lot better. Now they're going to say, okay, let's keep you there and monitor you. There is no exit strategy. And that's a challenge because every drug by definition has side effects. Long-term use of drugs is going to affect your body in a negative way down the road. It's guaranteed to happen. Yeah,
and it may be temporarily improving the headaches, but are they going away altogether? Maybe, maybe not. But eventually that medication will, you'll build up a tolerance to it, and they're monitoring you until that point comes, and they give you a stronger dose or another medication. There's not really an end game in sight. Whereas what we do is we look for the cause of those headaches and we address that so that you don't have to get worse.
Yeah. And why not work with the body if you're able to?
Exactly. So if we're talking to you, give us a call, 615-727-3107. That'll get you an exam, consultation, and x-rays. It's normally a $250 value for only $40. My office is in Brentwood. Jason's down in Franklin, but we've also got some trusted doctors around the Nashville area, Dixon and Hendersonville, Murfreesboro. We've got a bunch of guys around town. So give us a call, 615-727-3107, or check us out at aguidetohealthylivingradio.com. All the information's there as well.
Sounds good. Well, let's talk about this tip that you were just talking about at the end of the last segment.
Yeah.
I've had a number of my patients say, hey, can you go over that? And I've been showing them in my office how to do that. Can you give the listeners a little insight into what you're talking about?
Yeah, so if you were listening last week, this is a repeat, but what I was talking about last week was there is a little test you can do when you have a headache to see if it is potentially coming from your neck. Now, this is not 100% accurate all the time, but it is a good test if it does work. What you do when you have a headache is you go lay on your bed on your back and you let your head hang off the edge of the bed.
Okay.
Just for a couple of minutes, and if your headache actually starts to improve in either intensity or if it even goes away altogether, then that is a good sign that your neck problem is causing you to have headaches. Even though you may not have neck pain, it's causing you to have headaches, and that's something you need to get checked out because it is a structural problem, not a deficiency of Tylenol or Excedrin.
Yep. And if it is a structural problem, you needed someone who's an expert in correcting structural problems. That's what Dr. Liz and myself do. So if we're talking to you, give us a call, 615-727-3107. We'd love to help you and show you a different way.
Yep, and that, again, will get you an exam, consultation, and x-ray for a $250 value for only $40. And, again, offices Franklin, Brentwood, and all over other places in Nashville.
Yep. And if you're I love new patients that are like this also. I sit down with them, we start going over their history, and they say, Doc, I can tell you right here. If I push right here, I know this is exactly where my headache is coming from. You feel this bump, you feel this tight muscle, you feel this, it doesn't feel like that, and it's always right here. Those are the people that's a structural problem.
Exactly, and those are sometimes, I don't want to say they're the easiest ones to help, but they almost are because they've already identified the problem itself, so we know where to hone in on. But then you've got the ones that have no neck problem at all, and it takes a little more searching, and that's where our special kind of x-rays come into play because we can see what's actually going on the inside. We don't have x-ray vision. We don't have x-ray fingertips. It's something we have to see structurally whether it's working or not working.
Yep. Another one that if we're talking to you is saying, if I keep my head in this position, I'm guaranteed to have neck pain, headaches. Again, structural problem.
Again, yeah, another structural problem. There's multiple things that can cause headaches, but the most common one is your neck problems.
Yeah. Another way that you can see a structural problem is driving. If you have a challenge checking your right blind spot or your left blind spot because your neck doesn't move correctly, structural problem.
That's a very good point. That's probably when I ask people what kind of thing does your neck pain or neck problem cause, what kind of problems or how is it affecting you? Almost every single person says driving is probably the most place I notice it or the most common place I notice it if it's not because of they play sports or exercise or something else. That seems to be a very underlying theme.
Yep. I hear it all the time. Thank goodness that they put that backup camera right in the middle of my dashboard because I cannot turn my head to look over my right shoulder to see what's behind me.
Yeah. And I hate to know how many people are out on the road actually right now that can't check their blind spots and they're just changing lanes willy-nilly without even knowing it.
Yep. So if we're talking to you, give us a call. Exam, consultation, x-ray, $250 value we're offering for $40, but it's a limited number of spots, does not include Medicare or workers' comp. Jimmy, how are we looking? How many spots do we have left?
14
spots. So give us a call, 615-727-3107, or check us out at aguidetohealthylivingradio.com.
Yeah, definitely. Some other things that will show you if you have a problem with your neck or headaches. We've just talked about decreased range of motion. Now, if you can't look up, look down, look to the right, look to the left without having some form of pain, or you're trying to do that and you're barely moving, or you're turning your whole body to move, we're talking to you.
Another good test is, are you able to draw your ear down to your shoulder, almost touching your shoulder? Like right now I'm doing it in the studio here and my headphones are keeping me from actually going the rest of the way.
That's pretty impressive.
I know.
Yes.
But how many times do you do range of motion testing and, the person can just barely bend maybe 2 degrees to the right and 3 degrees to the left, and that's not a full range of motion. You should actually be able to almost put your ear to your shoulder without raising your shoulder.
And another beautiful thing with getting care is not only will the headaches decrease, your range of motion will increase. You're going to be able to move the way you're supposed to.
Which also will, in turn, make those big, nasty knots at the top of your shoulder feel a lot better.
Yep. So
if you're listening, give us a call, 615-727-3107. That'll get you that consultation, exam, and special x-rays. That's normally a $250 value for only $40. Give us a call, 615-727-3107, or aguidetohealthylivingradio.com. Check us out there. Follow us on Instagram. Check us out on Facebook. We post a lot of cool stuff and pictures as well. So we'll be back in just a moment. Stay tuned. Hey y'all, welcome back Nashville. You're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason here on News Radio 1510 WLAC. If you are just checking us out and just tuning in for the first time today, we've been talking about your headaches and neck pain. They're probably one of the most common things that we see patients for in our offices. We are your local health and wellness experts. We're both chiropractors, but we love treating everyone, basically.
Yeah. And you know what the interesting thing about headaches is they affect everyone. I have many patients that are young school age, elementary, all the way to, patients middle age. So, headaches are not selective to a particular age group.
No, and actually headaches, they tend to actually start, especially for women, because they are the ones that are more affected by headaches than men, but they typically start even in the teenage years, and typically they get worse and worse as we age.
Yeah. And we live, in today, there's many factors that are out of our control, but there are many factors that are within our control. And Dr. Liz and I touch on this in our offices too, giving you the correct information to do outside our office so you're not always creating the same problems that bring you into the office. We'll help you on workstation ergonomics, stretches, strengthening exercises, other things that will keep your neck in good condition so you're not just keeping on causing a further problem down the road.
Yeah, I like to do what I call is their Well, I guess officially it's called their home care workshop, but I call it the How Not to Screw Yourself Up Outside of My Office workshop. And usually it gets a good chuckle. But what we go over is how to use your pillow properly. What kind of pillow is best? How to sleep. Is back sleeping, side sleeping, stomach sleeping, which is really better for you? These are the kind of things that I like to make sure all of my patients know, because it's really important on what we do the other 23 hours and 35 minutes a day outside of that chiropractic adjustment appointment.
Well, and there's not a guide out there. So many people, they want to do better. They just don't know where to find the information. They don't know what their workstation's supposed to be like. They don't know what their bed is supposed to be like. Am I supposed to have a pillow top? Is it supposed to be firm? How fat's my pillow supposed to be? They don't know what to look for. And because of that, they're doing the best they can, but the best that they can is suffering headaches and neck pain all the time.
And it's recreating the problem over and over and over. You've heard of overuse injuries, and most commonly you associate that kind of thing with like runners. Runners end up with bad knees because they get overuse, that pounding on the pavement with the running. This is similar to other aspects of your body and your life. You can have overuse injuries even though it's not an exercise type of injury. You can have an overuse injury from slouching too much at your desk for the last 10 years, 8 hours a day, or however long you've been working at that desk job.
And if we're talking to you, if you're a headache sufferer, neck pain sufferer, and you're just like at the point you're saying, it's enough, give us a call, 615-727-3107. Get signed up. Exam consultation, x-rays. It's a $40 investment in your health. So give us a call, 615-727-3107.
Or, as always, if you don't have a pen, aguidetohealthylivingradio.com. That's the name of our show. Just type it in. You'll find our information there. You can also follow us on all the little social media platforms as well.
Yep. And Dr. Liz's office is in Brentwood. I'm a little south of her in Franklin. So give us a call if you're in that area. And if you're not, also give us a call, because we know a number of doctors in other areas. Say you're in Hendersonville or Murfreesboro. We'll get you set up with someone that can help you there too.
Yes. And they will also accept that $40 special that we're offering for our show.
Yeah. So if you are suffering from headaches, which we've already talked about, 80% of the population is suffering from tension headaches, we're talking to you. I always tell my patients, headaches are very common, but by no means are they normal. You're not supposed to experience headaches. People have headaches so often in today's world that they think, it's just a normal part of a weekly routine. And I'm here to tell you that it's not. What it is, though, is your body communicating with you saying, there is a problem, fix me, please. Headache will go away.
Exactly. And you know what? We've been talking a lot about headaches, and maybe you're saying, well, I don't get headaches. I get migraines. Hey, you know what? We can help those too. Headaches and migraines are typically tied in together. They both make your head hurt, but migraines are usually the ones that come with more the light sensitivity, the sound sensitivity, maybe even nausea, or even full on, you might actually throw up from having a headache so bad. These are the really, really bad ones. And I know those migraine sufferers, they love me, because when they finally stop having those migraines and they start to get their life back, they get their job back on track, they catch back up with stuff at home, they're able to have more fun with their families, their children, their spouse. They actually absolutely love that they have their life back once they stop having those migraines.
Yeah. But the challenge is you need to take action, because the truth in any type of healthcare, I don't care whether it's you're trying to lose weight, I don't care if it's you're trying to get in shape, you have to do something, because the biggest lie out there is if I do nothing, I stay the same. You're either getting better, you're getting worse, you're never staying the same. So if you are suffering from headaches, I don't want to be the bearer of bad news, but it's just not going to go away on its own.
No, it won't. But and also to touch on that, you're either getting better or you're getting worse. Most of the time, do we get better if we do nothing?
I wish I could say yes, but the answer is no.
No, unless it's just a paper cut. That'll heal on its own. But
Right.
Other than that, when we start talking about more structural or neurological problems, those, they can, what is it called? Waxing and waning, but they never truly will go away on their own. They will just continue to slowly deteriorate and slowly worsen over the next couple of months or years to a point where we might not be able to help you anymore.
And if you've been having headaches for a long period of time, meaning more than, I would say, over a month on like a regular basis.
Yeah. If you're getting them at least once a month, that's not even normal.
Yeah, your body is not healing and functioning and adapting to the environment properly. Your body needs help. That's where we come in. We need to remove that interference, get those bones sitting right, get pressure off of those areas of your neck that are causing the problems, let you get your life back.
You know what? Another thing I just thought about is those that do have those once a month headaches that typically follow a menstrual cycle.
Yeah,
you know what?
yep.
We can still help you. It might have something to do with your menstrual cycle, absolutely, because there is a hormonal fluctuation that happens, and it could trigger headaches, but still typically there is also a structural component.
Yeah, I love when I have some ladies that say, Dr. Jason, you're the only man that I want to see during my menstrual cycle because you help me with my headaches. I'm like, I'm glad I'm here for you.
There you go.
Yeah.
At least they don't snap at you, right?
No, not a bit. They're happy to be in my office. So.
Exactly. So it can definitely help with that as well. And this is kind of off on a side tangent, but if you're one of those people that gets low back pain during your menstrual cycle as well, that's also an awesome thing that we can help with. That was probably my favorite thing that I discovered in chiropractic school. And just about everybody that I went to class with knew my cycle because they knew when I was wanting an adjustment extra that day, it was because of that.
Yeah. Hey, there you go.
We learned to get real open and honest with each other in those classes. So if we're talking to you, give us a call, 615-727-3107. Come get your consultation and exam and special set of x-rays with us. It's normally a $250 value, but it's only $40 if you give us a call today, 615-727-3107 or a guide to healthylivingradio.com.
Yep. Another group of people that I want to talk to and just tell them to stop doing it right now are the self-neck poppers. I'm talking to you, the people out there that are grabbing your neck and say, when I get a headache, I just yank my head and I do this, and man, everything just goes and it gives me a relief for a little bit. You are doing nothing but hurting yourself.
Actually, this brings up a good point because it's been less than a month, actually, that this patient came in. She's been a self-cracker. It sounded like for quite a while. And she's like, oh, it used to help all the time. It used to help. It helped every time, and right here. And I would just pop my neck and do this. And she would show me what she was doing. And I was like, stop it. And what had happened was she actually did her same normal routine, which, had worked in the past. But this time it hurt. It hurt. It got worse. It felt bad. It felt terrible. She has a big knot on her neck. She basically sprained her own neck by cracking it herself by not knowing what she was actually doing in there. Just because you hear that crack and pop sound doesn't mean it's the right spot actually moving that needs to move.
Well, and there's a reason that you're doing it all the time. You are just making your neck move too much. You're making it sloppy. You're causing arthritis. And you're causing the problem to get much larger at an accelerated pace.
And so you might be thinking, well, how the heck is that different than what you guys do? Well, we actually go to school for 8 years to learn how to do it the right way so that you don't feel like you always need to pop and crack. I love it when patients tell me, you know what, Dr. Liz, I didn't feel like I needed to crack my own neck for the last couple days. That means what we're doing is actually stabilizing it, correcting your problem.
Yep. So give us a call, 615-727-3107, especially if you are a self-neck popper. We want to help you so we can get rid of that nasty habit. Again, 615-727-3107. We're talking exam, consultation, x-rays, $40 investment.
Yep. My office is in Brentwood. Dr. Jason's down in Franklin. You can definitely see either one of us, but we've also got a network of doctors around the Nashville area from Dixon to Murfreesboro to Hendersonville and all the way around. So give us a call. We can help you find somebody that we trust as well. 615-727-3107. And as always, you're listening to A Guide to Healthy Living. We'll be right back in just a minute.
Welcome back. You're listening to A Guide to Healthy Living here on News Radio 1510 WLAC. As always, I am Dr. Jason here with Dr. Liz. We're health and wellness experts. Dr. Liz's office is located in Brentwood. I'm a little south of her in Franklin. Today we're talking about headaches and neck pain.
We're talking about your headaches and your neck pain.
Yeah, we're talking about how 80% of the population suffer with a particular type of neck pain. Tension headaches, which mean if anyone pretty much is listening to this show right now, they've had what we're talking about.
Yeah, and the headaches, the neck pain, they really tie in together. But you can have neck pain without headaches, and you can have headache without neck pain, and it can still be causing each other.
But what they both have in common is your body trying to tell you there's a problem, please fix me.
Yeah, your body's crying out for help, and it's saying knock it off. And it can't fix itself, and it's asking you to help it, but what are you doing but masking it with medication?
But I don't think it's calling out for aspirin, Advil, ibuprofen, Tylenol.
No, you're just putting a little Band-Aid, a little patch over the top of it. only to let it return, a couple days later, a couple weeks later, a couple hours later, depending on how soon your headaches actually come back.
Yeah.
Or neck pain.
And if you're someone that has had headaches for a period of time, they're not going away. I don't mean to be the bearer of bad news, but if you don't do something different, they're not all of a sudden going to go away. I wish I could say that they would. But the beautiful thing is there's so much that can be done. You just need to try something different. And if we're talking to you, you're saying, I want to try something different, call us 615-727-3107 for $40. We're going to get you in our office, exam, consultation, x-rays. We're going to show you a different way.
Yeah, and if you were to take a visit to a conventional physician for your headaches and neck pain, there's a good chance you're going to leave with some sort of prescription medication or a stronger version of an over-the-counter medication. Even something as strong as an opioid, those things are highly addictive, and a lot of people are getting more and more information about them, and they're afraid to take this stuff, which you should be.
Yeah.
Those things were invented for cancer pain, not for aches and pains of the neck and back.
Yeah. And there are some people that, unfortunately, the only way that they can go is medications, and that's what got their life back. And God bless, medicine for that. But there's a lot of people out there that are taking meds right now because they just don't know there's another way. And if you went the other way, you wouldn't need that med because your body would actually be healing and working the way that it was supposed to work, and those headaches and neck pain would go away.
Yeah, and there's a time and a place for medications, absolutely. Emergency situations, that's the best time for it. But let's say your emergency, we'll call it emergency neck pain, your excruciating neck pain has now been dialed down to a tolerable level. Now what do you do from here so that doesn't happen again? You don't just keep taking the Vicodin. You don't just keep taking the, what do they give now, hydrocodone and all this other stuff that knocks you on your butt. What else can you do to avoid that situation happening again or even worsening?
Yeah. And if you're a person out there that, your answer to it is simply just medicate myself, deal with it, get tougher, try to get, someone to rub my neck or my back all the time.
Or the ones that are using the excuse of, it's just normal, I'm getting older. No, it's not normal.
Yeah, we're here to tell you that, one, no, that's not correct thinking. Two, like Dr. Liz says, it's not normal. And three, there's another way.
Oh, yes, there is another way. I thought you were going to tell them what to do.
Well.
What you need to do is give us a call, 615-727-3107. We have a better way. An exam, a consultation, and x-rays. We can see where the problem is actually coming from. We can form a solution and a plan specific to you and your needs. That test and everything is normally $250. Give us a call and it's only $40. 615-727-3107 or check us out at aguidetohealthylivingradio.com.
Yep. And, the beautiful thing, too, is so many people have gone the route now of chiropractic for headaches and neck pain. It's a very accepted thing. There's so many people out there now that you can talk to that say, I wish I would have known about this years ago.
Oh, yeah.
They're my biggest advocates. It's so interesting when I have the people that come into my office and they tell me, and I love them for doing this. They say, you know what, I've been on meds. I've tried all these things. I really don't want to be here, but
I've had surgery,
but you take care of so-and-so, and they have spoke so highly of you. I'm giving you a chance, but I'm letting you know I don't have much hope. I say thank you.
They're hesitant or they're afraid or they've heard bad stuff.
I'm like, thank you for letting me know where you're at. That's great. And then once we do what we do our exams, we take our specific x-rays, we educate them on what's going on and show them a plan of action to get them the results they want, they're excited. But then once their body starts functioning better and they start seeing changes, they are my biggest advocates. They'll scream about what chiropractic can do from the mountaintop.
Absolutely. And it's so exciting and almost liberating to discover that you don't have to live like that.
No.
I can't imagine living like that. You're only around for a little while. Why would you want to suffer for the little time you do have?
Well, and you think about it, because people absolutely come into my office for neck pain and headaches, but what even brings them in more is what it represents negatively in their life. Because of my headaches, I'm not the mom I want to be. I'm not the dad I want to be. I don't have patience with my kids. My work is suffering.
Yeah, I'm not able to focus. I'm having to lay down in my cubicle or in my office all the time. I'm not as productive.
Yeah, I have golfers that come in. They're like, I can't play golf because swinging that club, I know it's going to trigger neck pain. I can't do it. I want to be able to go play, golf with the guys.
Mm-hmm. Or the low back pain's a common one with golfers too. I have a guy that came in just recently that's been avoiding playing golf, and he's been coming in for a couple weeks now. And he said, "Hey, Dr. Liz, when do you think I could start playing golf again?" And we kind of went through a couple of questions, and I asked him some specific things about his progress. And I said, you know what? I want you to try that out this weekend. Just go and do 9 holes, and we'll see how he's doing next week when he gets back in. But that was his homework, was to go play golf.
Yeah. So if we're talking to you, again, 615-727-3107. Call us now. Get an appointment in our office. Let us show you a different way. Jimmy, how are we looking with appointment slots?
Only 7 left.
Only 7 left. So give us a call. That number again, 615-727-3107. That'll get you a consultation, exam, and x-rays. It's normally a $250 value. We're offering it for only $40. Give us a call or check us out at aguidetohealthylivingradio.com. And that phone number again, 615-727-3107.
Yeah, and Dr. Liz's office is in Brentwood. I'm located in Franklin. But if you're someone, Murfreesboro, Hendersonville, or an area that's not close to either Brentwood or Franklin, please give us a call. Also, we have other doctors in that area. They'll honor this special to get you in, and we'll get you hooked up with them.
Yes, people that we trust and have been adjusted by ourselves.
Yes, absolutely. You know, another big one that I have come in my office, unfortunately, is the person that got in an auto wreck because they couldn't turn their head to see someone in their blind spot. Boom, wreck. Don't wait for that to happen. The other thing, too, is if you are, I call it the robot posture, every time you go to move, you look like a robot because you have no mobility. Your body is seizing up. It's only going to get worse. Take action, correct the problem.
And you know what? Dr. Jason brings up a good point. The car accident person. If you have ever had a car accident that is even a small fender bender over the mileage of, what is it, what is that study, 8.4?
I believe it's 8.4, yes.
8.4 miles an hour is the minimum amount of speed and an impact, and that can actually create neck problems. The problem with those slow speed impacts is they usually don't create neck problems for 5 to 10 years. So you could have had an accident in your high school years. You might be in your 30s now, and all of a sudden, I just woke up with neck pain one day. No, you really didn't just wake up with it. It's been brewing for the last 15 years. You're just not associating it with its original cause.
I see so many patients like this, what Dr. Liz is talking about right now. You've been in some form of auto accident. Usually it's some form of a whiplash accident. You were rear-ended somehow.
Or T-boned.
T-boned also. And then what happens is you got on some meds, some muscle relaxers, things like that. After a while, the pain went away and you thought the problem went away. It really didn't. What you had was a small structural problem that years and years and years developed into a big problem. Now you're having all this neck pain. If you're out there and you've been in an accident, a rear-ended T-bone, and you never got checked out by a chiropractor to see what condition your neck is,
get in ASAP.
Yeah, absolutely.
You'd be surprised how much damage is really done, even in those low-speed impacts. And what I mean by low speed is, 8.5 miles an hour. That's barely rolling out of a parking space. And the people at Yale, they're pretty smart. They figured this out with the little crash test dummies. You remember those commercials? They were doing those tests at, 60 and 70 miles an hour. Sure, you don't fly through the windshield at 8.5 miles an hour, but it's still enough to cause structural problems.
Yeah, so if we're talking to you, you're around the Brentwood, Franklin area, give us a call, 615-727-3107.
Yep, give us a call, and we'll help check you out and make sure that everything's working properly. Even if you're just coming in to see if you have a problem. Let's say you don't even have any symptoms, but you're thinking, well, crap, Dr. Liz, I have had a car accident, and you know what? I did get some soreness for a couple weeks, but that was 20 years ago. I say still come in. You'd be surprised what we can find on an x-ray that could prevent you from actually ever having the symptoms that we know it can cause down the road.
Or if you're the person that said, well, you know what? I only get headaches, maybe a couple a month. I wish I could say, you're fine because it's only going to stay at that. No, that problem's going to get bigger. A couple a month is a problem. Correct it while it's smaller. Instead of waiting till now I'm getting one once a week, now I'm getting a couple a week. Don't let it progress and get bigger. Take care of it now.
Yeah, I don't know why you would want to let it test it out to see if it gets worse. Doesn't make any sense to me. But, it's a very common thing that we see in our society is we think that headaches, neck pain, low back pain, we think it's normal because it's so common. Common and normal, not the same thing.
Yeah, and if we're talking to you, we've talked about the self-neck popper, people in auto accidents, people that wake up with neck pain. They go to work, they have neck pain. They have headaches on a regular basis. Give us a call, 615-727-3107. Let us check you out. Let us show you what's going wrong so that you can get your life back and stop suffering from these neck pains and headaches.
Yeah, and we're about to wrap up the show for today, but we've got some exciting things coming up down the pipeline for future shows. Some segments that we're working on with some community partners out in the Nashville area.
Yeah, it's very exciting. We're going to be partnering with some people to bring you health and a lot of other fields too. What you consume, what you put on your body. There's a lot of different things that we're going to partner with, and we're going to pass that information on to you.
Yeah, because we know it's sometimes it's hard to figure out what's right and what's wrong. We want to make it easier for you because health doesn't have to be hard. You just got to know where to look for the information. So you're listening to A Guide to Healthy Living. As always, give us a call, 615-727-3107 if you want to get checked out in our office. We will see you, I guess, next week.
Yeah, have a wonderful week. Nashville, Franklin, Brentwood, and all surrounding areas.